it's getting pretty bad in the U.S. Places where it's snowing, people are indoors.
Right.
Yep.
I just read something about several more states heading into lockdown in the next couple of days. So I think it's interesting that our conversation is going in the total opposite direction. I mean, silver linings, I guess. 807, Dr. Ann Pobutsky, Department of Public Health and Social Services. She is the territorial epidemiologist. And thank you for coming on again this Friday, Doc. Appreciate it.
Sure.
If you could, I mean, we kind of wanted to talk about just the week's data. It does look like we're seeing a decline, and most of it is coming from this community mass testing, right?
I think that the numbers aren't the result of the mass testing. The numbers are a result of less people testing positive after those two big giant clusters at the two congregate facilities, the construction barracks and then the DOC. And our numbers have been going down. They're now in double digits. Yesterday there was 22 positives, but we're at almost 7,000 cases. And we haven't seen any deaths this week. And we do not know if there's been a Thanksgiving kind of surge. We should be seeing it soon if we are going to see a surge, but the numbers are trending downward, which is good. And we hope to sustain those low numbers on our island with the community's help. It sounds like the community is listening to the message, and I guess people must have had a low-key Thanksgiving. We won't know probably till after the weekend and into next week. And then we're also hoping people will have a low-key kind of Christmas.
Well, they're not, because we're going to get rewarded. So I feel like the danger in this conversation that we're having, and man, there's something Dr. Cabrera says: discussions are not decisions. But I feel like the seed has definitely been planted, and as we start to see a decline in the number of positives and the conversation more about keeping this CAR score as low as it is, so that we can see easing of restrictions, I think a lot of people are already starting to check out from the pandemic. They're, oh man, it's already over. And I think that's kind of dangerous, because I feel like this happened the last time when we kind of rushed into normalcy, and I don't know, that kind of prompted this whole surge that we're just now starting to come out of.
Right, and I don't know the exact plan. It's the governor who's going to decide what to do, and she's, again, getting advice from the physicians group. And the talk was maybe try and open the island little by little first before we, open up to other people. I certainly don't want to see people coming here from the U.S. unless they can be tested negative, because that's where the surge is. I mean, you look around the region, Manila, Japan don't look so good. Korea looks good. It'd be great. There was talk about opening up our island, maybe opening up the schools, maybe opening up, so the island can open up first. And I think that's going to be gradual. At the same time, people have to realize this is a pandemic. We're not out of the woods just because we have a low CAR score. We still have really high incidence rates for our small population, and we need to get it down to nothing, I would hope.
Yeah.
And this is not something that's going to end right now. We're talking 6 months for the vaccination to get everywhere, and Guam included, and the region. And, it's going to start with, frontline health workers, people at risk. And so that's going to take time, and there's logistics involved. And so it's going to take time for this thing to end. It's not going to magically happen. Here's your Christmas present. It's over. Sorry. This is going to continue, and we just need to stay the course.
Doc, I don't want to put you in a position to step on anyone's toes, but you talked about the governor getting advice from the Physicians Advisory Group, right, which is comprised of, for the most part, if not all of them, are, I want to say, private sector doctors. But from the public health standpoint, as an epidemiologist, when we talk about easing of restrictions, and I know it's not your call, but I just really want to hear from a public health perspective, what would be the most prudent way to ease restrictions, and which restrictions could we ease slowly without, throwing open the doors and releasing the Kraken, the COVID Kraken on the community?
Well, there was this kind of risk assessment that I think Texas put out, and it went from low to high. And of course, the worst places are bars and, not so much restaurants, but bars are really bad. Churches places where people congregate and are singing or partying, those are bad. I really don't know what her plan is, but I did see in the paper they're talking about the schools. I think people would like to see the kids get back to school, and we do have more testing capability with the Binax antigen test. It's good for congregate settings like schools, but we don't know how helpful it is with little kids yet. It works in college-age kids, and that's what they're doing across the U.S. is a lot of testing. So in order to do that, we would need to beef up the testing for the schools and have plans in place for if the schools open, if the kids get sick, how do we address that and move forward? So it really depends. I don't have any idea about what the plans are.
Right. That's why.
But yes,
yeah.
Public health perspective, I'm not as concerned about the economy. I had to drive into Tucumán last weekend, and it's a ghost town. I understand that people want to see the tourists come back and businesses open, but there was some suggestions. We should open up the island first. Let's be safe on our island and get this under control before we open up to tourism. And we really do have to do that first. We have to contain the spread of this nasty virus before we start opening things up. So I think there's talk about opening the schools in January. Let's see how we do with maybe not having a Thanksgiving surge and not having a Christmas surge. So I say let's wait and see. And I'm sure that's what the governor's taking a look at, because she has to look at everything.
Right.
And yes, public health, we tend to be a little more dour because of what we see and what we've seen here recently with the surge. I'm glad there's no deaths this past several days. I'm so happy about that.
Yeah.
And again, the deaths always lag after a surge, even getting those numbers. And we've gotten that down to, it's like there's been none in the past several days. That makes me happy because that's the data I've been analyzing.
Yeah.
Speaking of data that you're analyzing, the new cases that we have been seeing, do you have any more specific information in terms of like the demographics?
I'm having trouble hearing. What's the question?
The numbers, the positive cases that we're seeing, do you have any information on the demographics? Are they younger?
We just have the daily numbers. I have the sit rep from last week. Again, the biggest numbers, this is the total numbers, are in the 20 to 59 age group. You guys can get this on the website or the sit rep. It's not like we're seeing anything different. We're still seeing a lot of household spread. We're also seeing some continuing to see workplace, but again, these are just totals. This is not weekly summary.
Right.
And where are you guys? I know that you had mentioned, and the legislature's been asking for more detailed information, and
we're working on it, but we get pulled into other things, mostly meetings.
Right.
And we're working on it. We're trying to produce the daily numbers and try to get a little more detail in a weekly surveillance report. That is not happening right now, mainly because Stephanie is leaving. She's going on vacation, and then she's moving over to PIHOA. So I'm losing someone who's done the bulk of the daily numbers. But we did headhunt a guy from UOG. He's a math instructor up there, and we stole him from UOG. Actually, he still does his online courses, but he's helping with the daily numbers, and I'm going to start working with him on this weekly report about what we want to see. But Stephanie kind of set up this system, so we have to work with what she created and move forward. And I don't know when it's going to come out. Maybe, I don't know. I really can't predict this because I get pulled into meetings all the time and don't have time to do the day-to-day counts of the numbers. I just don't.
Yeah.
And we need a little more help there, and we're getting it. We're starting to get it, so that's good. And we're all in one place here at ITC now. The containment and isolation folks and the case investigators are all in one place, which should make that easier if we do see a surge, and to continue to populate the database with the numbers, et cetera.
Would you have any information on the cluster over at Pacific Rim Constructors?
No, I do not
Okay.
at this time.
Yeah.
No, the case investigator, our response coordinators are probably addressing that. I didn't get any details. We had some other big issues this week, including a do not board positive COVID case, and we've seen a bunch of leptospirosis. We're trying to get a press release out on that.
Oh God, I went hiking the other.
It's because of the rain. We saw finally got confirmation on 2 last month, and then so there's 5 confirmed cases and 3 more probable in the past 7 weeks. And one was a group that was swimming in a river. Most of these leptospirosis cases, even in years past, occur in the South, people swimming or hiking after a big rain. And we've had a lot of rain this year. We're lucky we're not seeing dengue, but we want people to be careful after big rains. You know, it's not really a good time to go hiking in the rainy season, especially if you slip and fall.
Yeah. How's that going to affect our car score, though, that lepto? Is it?
It won't. It won't. Unless these people all are hiking together and they all get COVID and leptospirosis.
Just so you guys know, lepto, it's caused from like the animal feces, right? And when the rain washes it down into the river and you swim with an open cutter.
Yeah, wild pigs, caribou, dogs, rats, you know, it's just wildlife.
Nice.
And it tends to get into the rivers and streams. And if you know, slip, muddy, any place where there's flooding, where there's been, you know, runoff. So that's, we hope to get a press release out today for people to be careful. Again, don't go hiking in the rainy season. Wait for dry season. If we ever get a dry season, It's been a wet year.
I think it's really important to get that release out, Doc, because a lot of people, even if it is rainy season, are going out hiking because there's really not much else to do. And it's a habit that I think a lot of people picked up, right, during this pandemic.
Right, and people should wear protective clothing, and they, you know, try not to swallow water if you're swimming, or better yet, don't go swimming in the river when you don't know how, you know, what's in there. We just want people to be aware of the risk, because it's kind of nasty too. It has some of the similar symptoms, you know, body aches, fever, as flu and these other things like COVID. So we're just wanting to warn the public that to be, you know, that it's risky to go swimming in the river after a big rain and it's flooding and muddy, and you also could slip and fall and get an injury as well.
Doc, are you involved with any of the talks regarding the vaccination?
Some. I'm actually on a call tomorrow, but it's a national call. That's Erica. She's the head of the Bureau of Communicable Disease Control, but she's former head of the immunization branch. So those are the folks that are doing the planning for that. I'm just peripherally involved.
Yeah.
Okay.
We're trying to get her.
It's coming.
Yeah.
All right.
It's coming.
You know, a gradual phase in of the vaccine and how it arrives and gets stored, and, you know, getting people educated about how it works, because one of them, I believe it's the Pfizer vaccine, requires 2 shots. Is it Pfizer? Anyway, people will let you know once that gets rolled out.
All right. Well, thanks a lot.
Yeah.
He has a call right at this time in the morning for the mass vaccination plans.
Okay.
Warp speed, as they say.
Thanks, Doc, for your time. Anything in closing that you want to add before we let you go?
No, just be safe. Continue vigilance. This is not over. We've got at least another 6 months now that a vaccine is coming. We still have to, you know, I don't think masks are going to go away. I like the mask. I haven't gotten a cold or the flu or COVID since I've been wearing a mask all the time. And I think that's great. And washing your hands, that shouldn't stop just because, you know, the pandemic is over. So we want people to continue these kinds of activities, wearing a mask. I don't think it's going to go away when you visit places in Asia. People are always wearing masks in China, whether there's a pandemic or not, because there's so much respiratory illness in the tropics.
Yeah. And
So,
who knows
I don't
after
think
COVID?
maybe it'll become a fashion thing. People just continue to wear it because they don't want to get a respiratory virus, whether it's COVID or flu or a cold or anything. So that's my take.
I'm
Bear
down.
with us.
Yeah.
It's going to continue. We want you to be safe. And we want to thank the community too, because the numbers are going down. We hope it stays this way, down, down, down to nothing.
Right on, Doc.
Thanks, Doc.
Appreciate it. Very positive
Sure.
talk. Good to hear from you.
Okay.
Okay, we'll see you.
Adios.
Adios.
Bye.
Let's keep it in the KUAV News Zoom room and go over to Dr. Peter Lombard, who's been standing by. Thanks.